And bonjour, Bruno here, together with Daniel Ramillo. This is the LARVOL CLIN podcast, Build in Public, and actually not only Build in Public today, but also on the go. I'm here live. You can guess where I am, right, Daniel?
Oh, yes.
Yeah,
I can smell it too.
it's Times Square, center of the world. And I'm here because, well, first I'm in New York. Second, on tomorrow, Friday, on this billboard here behind me, okay, we will highlight um, five top voices, patient advocates. We did that before, some of you knows, with key opinion leaders. And so we're going to talk about why we're doing it and also how we determine who goes on this billboard. Now, we call this the LARVOL at Times Square billboard. Although, in all fairness, we're renting that billboard only for a limited amount of time, every month or so. So, again, welcome to Times Square. You've been here many times, right, Danielle?
Yep.
I just have two hopes here. Number one, I hope that nobody's going to grab my phone and run with it. You never know. That would make it
That's
interesting.
it's always a good worry in New York. Anywhere in New York, to be fair. In Times
And
Square,
also,
other places.
yes. It has never happened to me. I had an attempt one time. Sometimes I tried to grab my phone, but it only happened one time. And second, I hope that the noise canceling here does a fair job. So
It
the
is
audience can tell us.
it is doing a great job.
Uh, the other thing I want to say is that if you're listening, drop us a note, ask us a question, put a comment. We love that, and we'll respond live because this is a live podcast today. All right. So let me say first a few words about the billboard and about why we're doing it, and then I will pass the baton to Danielle, who will walk us through the methodology that we're using to select who are the top digital opinion leaders in cancer. So first, why are we doing it? Well, we appreciate all of the sharing that these doctors that are very busy taking care of patients, all of the work that they're doing to share their expertise on social media, notably on X. And they're sharing this, they have a deep conversation actually about the pros and cons of every therapy. And this is very helpful for everybody. This is very helpful for people in the US. We know that a lot of people in low and mid-income country, like including India, rely a lot on that conversation to guide their practice as well. And for us, it's a way to highlight and to amplify the KOLs and the DOLs. They don't do it for the money. Clearly, they do it for to help first, and also to a degree, let's acknowledge it, because they like to be recognized, right? They like the status, they like the amplification. So when we highlight them on the billboard here, we give them and amplify a little bit of extra status. Now, this billboard is not the big one, right? I mean, you get bigger billboard here, you get bigger billboard here, you've got a bigger billboard here. So this is a mid-sized billboard, okay, on Times Square, just above the Pearly Soccer restaurant. So if you come to Times Square and you see this Pearly restaurant, you know that the LARVOL billboard is just above it, right? That's our billboard. Right? So let me now pass the baton to you to go through the part of LARVOL CLIN where we highlight our digital opinion leaders and maybe describe the methodology, the ranking system, the methodology we use, which is very thoughtful. One more comment, then I go on mute as you present it. But we internally are going through nearly unreasonable discussions, debate, fights about every little aspects of the methodology used to rank our digital opinion leaders. And so I hope the result is useful, but certainly I will immodestly say that it is the most rigorous and consistent methodology that anybody is using in the world of oncology opinion leaders. That's my pitch. I'm going on mute now and pass the microphone to you, Daniel.
All right. Well, I'm on CLIN right now. I'm on the influencers tab. And here we have, I mean, I'm seeing all of them right now, but we have them ranked by what we define as the CLIN score. The CLIN score is a score that we calculate. And if we click on it, we can see the details. So let's pick, give me any doctor. Let's do Dr. Urin. So we open Dr. Urin's profile. You can see all of the recent interactions he's had on social media, of course, ranked, right, by practice changing, not rated, positive, practice informing, mixed, so on and so forth. And then we've got a CLIN score. And over here, you can see the breakdown of said CLIN score right at the top, right? So a percentage of it is peer nominations. That is when another oncologist nominates them on the polls that we do every year. We have another one that is engagement. So how much engagement they're getting, what the type of engagement they're getting with the engagement score over here, and the reactions they have, right? So how many reactions are they getting cumulatively and the reaction score that they have. We can see, I think we're at 0 nominations. This is probably because we haven't run a test with them. I'm surprised that Dr. Irwin would get 0 nominations. We'll double check on that. 37.4 CLIN score, and he's a top voice in GU. And if you click the image, of course, it'll take you to their X profile. Let's go back and see the whole list, and we're going to open the analytics so that we can see it.
And just before that, I think it's a mistake for Dr. Owen. I nominate him. He's a cool dude.
I'd nominate him as well. The Aquaman of cancer.
So let's go to Dr. Sibelu or Tom Powers to pick, of course, famous digital influencer names and look at their individual profiles.
They do have nominations. So Dr. Liu has 32 nominations, a crazy, almost perfect CLIN score, 92.4, 46 engagement count, crazy reaction score. Look at that. He got a perfect score for reactions. Basically, the only thing that lowered his CLIN score is the engagement. That's it. The rest of it is basically perfect.
And so we cover about 6,000 digital opinion leaders in cancer. Our coverage is really X, is really Twitter, because over the years we have, at least up to now, concluded that the conversation in LinkedIn is not sufficiently broad or active to be monitored. So we do not include LinkedIn conversation right now. That conversation is not active enough. We're limiting ourselves to X. The other thing I want to say is that out of the 6,000 oncologists, I use a rule of 80-20, or I adjust it everywhere, as you know, these days. But 200 of these oncologists represents about 80% of the meaningful engagement and conversation. And out of these 200 who are surveying, we are selecting the top 100 voices, the top 100 voices. So every year we have our oncologist digital opinion leaders top 100. The survey is essential to determine that top 100. So in each of the cancer area like GI, GU, lung, breast, etc., we have about 10 KOLs or DOLs in each of these. And these 10 DOLs are the one we put on the billboard here once a year.
And what I was just posting on here is we have an analytics tab for influencers, right? And it basically quantifies the number of views they have to the number of posts that they did. You can come in and see it. I was a little bit surprised because This is not a top voice, and he got crazy amount of views. So I wanted to see kind of what the engagement was for the 5.4 million views that he got. Very interested in it. Oh, there we go. 480,000 views for this one.
So as you said, there are two dimensions that we're using in terms of social media ranking. At least two. One is number of views. So our analytics create a stacking, a ranking based on number of views of their tweets, their X posts. And number two, the number of posts themselves, how how much volume of posting. Now, we don't take all the volume, by the way. Every tweet doesn't count. It's only the tweets that are talking about clinical data. So some of the key opinion leaders have a very broad conversation. They talk about all kinds of things, politics, personal, patient advocacy, sometimes in a very meaningful way. Dr. Mark Lewis, in particular, who's both a patient advocate and digital opinion leaders, and you probably have him there. And so the posts that we include in our analytics are only the posts that talk about clinical data. That's why it's called CLIN, or clinical.
I was just trying to find Dr. Lewis. He's down here. 698,000 engagement. Of course, that is just his clinical tweets. I'm sure if we count the rest of his tweets, he's going to be well on the top of the list.
Now, Dr. Lewis, because he's actually the only one who is both a top digital opinion leaders and a top advocate, patient advocate. So it's going to be twice on the billboard this year.
Double billboard.
It is of them.
Coffee, though. Okay, let's go back to the influencers and then show you all the other functions we have on this tab. So apart from being able to see them ranked by CLIN score, you can sort by top voice, so you can see just general CLIN score. I think up to maybe the first 4 lines they're all top voices, and then when you get to right after Dr. Kathy Yang, some non-top voices will have a really high CLIN score. You can click in and see if that's because of nominations, if that's because of engagement, of reactions, so on and so forth. But then the other thing you can do is you can search by different tags that we have classified these digital opinion leaders as. So you can search them by name or handle if you know specifically who you're looking for and who you want to see kind of what the general sentiment for their posting is. You can search by institution. You can search by cancer area, by location. So let's be a little bit patriotic here. And let's go Colombia, right? We can find all of the DOLs for Colombia. If you want to look for another country, right? Say we want to find all the influencers that are treating, I don't know, let's do GYN. I think my internet dropped for a second and I can't load.
No.
There you go. By institution. Or you can only search for the top voices, which is, again, the tags that we see here, which is the people that you've seen on the billboards that we're going to put. Tomorrow is the day, right, for the patient advocates? What time, if anybody's in New York, what times is it going to be showing at?
Well, actually, I cannot tell you exactly what time. Shahir, our executive producer, who's up there in the
Omnipresent.
crowd, omnipresent, can chime in if he knows the time. He's going to be playing 15 seconds every hour. If so, here, if you know at what time, let us know. If not, it'd be a surprise. We'll announce it tomorrow.
We'll keep it a surprise for now.
We'll keep it a
Oh.
surprise. Like that. So we are essentially out of time. I want to thank you, Danielle, and again, Shahir, executive producer. Thank you for organizing this on-site, on-the-go, and building public for LARVOL CLIN. We'll see you next week. And what's coming soon, by the way, WCLC World Lung Conference. I will be there. And after that, ESMO. So for these two big conferences, we will have special activity and review of CLIN, how CLIN can help prepare for both of these key conferences. So drop us a note and we can be in contact or even send you credentials for CLIN to try us.
We're also going to Pharmacy I, so if you're stopping by Pharmacy I, let us know.
That's correct.
We can say hi.
And in this case, we means actually both of us, since Daniel will be with me at the Pharmacy I conference in New Jersey. On this note, au revoir.
Ciao, ciao.